these videos telling people to do something to their vagina to get rid of GBS are implying that having GBS is abnormal. Having GBS is not abnormal. It is a normal bacterium in the microbiome of the intestine and the vagina. Now, when we do the GBS swab in pregnancy, the proper way to do it is in the lower third of the vaginal vault, down through the perineum, and just right into the rectal opening. We need to sample both areas because vaginal rectal colonization is what it's important. Because during labor and delivery, those areas are so close together that if you have it in your rectum, you want to know because that could still infect the neonate. She says to use tea tree oil suppositories. Don't do that. No evidence. She talks about using probiotics. If you want to use a probiotic, have at it. It may help, it may not. No definitive evidence. Then she talks about how your pH could be off, which could be causing this GBS colonization, which is simply not true. And to take high-dose iodine. Again, no evidence to support that. And then she says something about how if you have vaginal discharge and it bleaches your underwear, that's a sign that your pH is off. Also not true. The pH of the vagina is slightly acidic, so vaginal discharge can bleach your underwear. So let me tell you what is true about GBS in pregnancy. A rectovaginal GBS swab should be done between 36 weeks and 0 days and 37 weeks and 6 days in each pregnancy. People could be GBS negative in one pregnancy and GBS positive in the next, for no good reason. If you are GBS positive, doesn't mean you're dirty, doesn't mean your pH is off, doesn't mean you need to do something different. It means you're normal. You just happen to be GBS positive and you will need antibiotics in labor. If you have a urinary tract infection at any time in your pregnancy that grows GBS as the bacteria, you will need antibiotics in labor as well. Treatment of GBS in labor is for the prevention of early onset GBS disease in the neonate. And that presents within 7 days of birth and is due to vertical transmission, meaning during the labor and delivery process. Early onset GBS disease can cause sepsis, pneumonia, less frequently meningitis, and is most likely to manifest or show up within the first 12 to 48 hours after birth. 10 to 30% of pregnant individuals will be GBS positive. 50% of pregnant individuals who are GBS positive will transmit the bacteria to their newborn during labor and delivery. If there is no antibiotic prophylaxis given during labor and delivery, 1 to 2% of these newborns will get early onset GBS disease. And among all cases of early onset GBS disease, 72% occur in term newborns. The mortality rate of GBS, early onset GBS disease in term newborns is 2.1% and 19.1% if the neonate is preterm. So some people may watch this video and say 2.1% chance of neonatal mortality isn't very high if I don't take antibiotics. It actually is, especially when it can be prevented with antibiotics. Sometimes we make recommendations in obstetrical care because even though the risk of getting that, like listeria in pregnancy, is low, the consequences can be very, very severe to either the pregnant individual or the neonate. And early onset GBS disease is one of these things.